Hey, this is Dr. Nate Walsh, one of the surgeons at the Clayman Thyroid Center at the Hospital for Endocrine Surgery. In this video, we're going to talk about the common medical disorders of the thyroid and the medications used to treat them. If you've been diagnosed with one of these common disorders of the thyroid gland, medication can end up being the mainstay of treatment. In these subsequent videos, we'll talk about the common medical disorders of the thyroid gland and how medication is used to treat them. Hypothyroidism, as noted in previous videos, is the most common medical disorder of the thyroid gland. Simply put, this condition involves a lack of sufficient production of thyroid hormone to meet the body's physiologic needs. Not surprisingly, medical treatment for this involves replacing the thyroid hormone that the gland no longer makes in adequate amounts. There are numerous thyroid medications which involve different forms of the thyroid hormone, or in some instances, combinations of different forms of thyroid hormone. The most commonly prescribed class of medications for treating hypothyroidism are those that replace T4, which is the most abundant form of thyroid hormone made by the thyroid gland. This hormone, delivered by the medication, then gets converted by the body to the more active form of thyroid hormone, which is free T3. There is a smaller class of medications that replace T3, which is a more active form of thyroid hormone throughout the body. Finally, there is a small class of medications derived from more natural sources that deliver a combination of T3 and T4 to the body. Most patients with hypothyroidism do very well by taking the most commonly prescribed class of medications, which delivers T4. Some examples of these medications include Levothyroxine and Synthroid. It is important to note that if you're on thyroid hormone medicine, you need to be taking it regularly, every day, at the same time, on an empty stomach, and be checking with your doctor periodically so they can monitor your thyroid hormone levels and make sure your dose is appropriate for your body's physiology. The second most common medical disorder of the thyroid gland is hyperthyroidism. As noted in previous videos, this is a condition where the gland makes too much thyroid hormone or makes thyroid hormone when the body does not need it. Almost all patients with hyperthyroidism need to take medication to ensure their thyroid levels do not get dangerously or inappropriately high to where they become very symptomatic and in some rare circumstances end up in the hospital for treatment. The most commonly prescribed medications for treatment of hyperthyroidism, even if it's caused by Graves' disease, are Methimazole and Propylthiouracil, or PTU. Both these medications block or inhibit an enzyme that is important in the production of new thyroid hormone. In addition to these medications, some patients also take a class of medications known as beta blockers. These medications are commonly used to treat disorders of the heart and high blood pressure, but can also be used to manage symptoms associated with hyperthyroidism. One of these beta blocker medications, known as propranolol, is also beneficial in treating hyperthyroidism because it helps block the conversion of T4 to the more active form of free T3 in the body. If you are taking Methimazole or PTU and/or a beta blocker to treat your hyperthyroidism, it is important to take them as prescribed and to also check in with your prescribing physician regularly to monitor your thyroid levels, and in the case of Methimazole and PTU, some other levels in the body to make sure you're not having any adverse side effects from the medications. As mentioned in a previous video, a less common medical thyroid disorder is thyroiditis, or simply inflammation of the thyroid gland. While this is most commonly caused by Hashimoto's or Graves' disease, there are some other rare causes which include medication side effects and viral illnesses. Treatment of thyroiditis in the short term typically involves non-steroidal anti-inflammatory medications, steroids in some cases, ice, and symptomatic management. It is also important to remove the offending agent if there is a specific cause for the thyroiditis, such as a medication side effect. While the aforementioned thyroid disorders can be managed and treated medically, there are many instances where a more permanent solution or treatment is necessary. Primarily involving hyperthyroidism and Graves' disease, many patients need a definitive treatment, as medical management long-term for many years is not a safe or viable option. In cases of hyperthyroidism caused by Graves' disease, surgery is the most definitive and reliable treatment to ensure the Graves' disease is cured and does not cause any problems down the line. Another option for Graves' disease and hyperthyroidism is radioactive iodine ablation of the thyroid gland. Radioactive iodine can be used to burn out or chemically ablate the thyroid gland so it is not overactive or producing too much thyroid hormone. This medical treatment is less reliable and durable than surgery. While thyroid surgery is much more common to treat Graves' disease or conditions of hyperthyroidism where people have an enlarged thyroid and nodules, Hashimoto's disease in a smaller percentage of patients can also be treated definitively by removing the entire thyroid gland with an expert surgery. While most patients who have Hashimoto's disease do very well with medical management, roughly 5 to 10% of patients end up in a chronic state where they do not feel well, have fluctuating symptoms, or fluctuating doses of their medication, and in general are not able to get a good grasp or handle on their medical thyroid disease. These patients often benefit from a definitive treatment of their Hashimoto's, which involves surgical removal of their thyroid gland. In conclusion, the aforementioned disorders of the thyroid gland are commonly treated and maintained with medical therapy. Hyperthyroidism and/or Graves' disease can often require a more definitive treatment, whether that be radioactive iodine ablation or an expert thyroid surgery to remove the entire thyroid gland. For more information about treatment and surgery for Hashimoto's and Graves' disease, visit our website at thyroidcancer.com and check out the links below in the caption.